I worked with Dr. Pugh in the Technology-Enabled Clinical Improvement Center, and her work focuses on quantifying physician performance. She uses sensors, primarily motion capture sensors, to look at how physicians perform often simulated tasks, to be able to understand and put some numbers to what the best are doing, and how do we understand kind of what separates the best from the rest of us. The project I worked with was actually an anesthesia project, looking at motion capture during an intubation task. We put motion capture sensors on participants' hands as well as on the laryngoscope, and then looked at motion during an intubation task. And one of the metrics we looked at was idle time, so looking at the time when you're not moving as opposed to when you are moving. Dr. Pugh's been a great mentor. Has really helped me get my feet going on the projects that I worked with during my time in the lab, and then I've continued to collaborate with her through some projects. And this is an area of research that I am excited about and hope to continue during my career. And when I have questions, she'll be someone that I will kind of reach back to help answer these questions about how do I start to set up my own research, how do I find funding, and how do I keep moving forward.